Welcome back to ABC News Live Reports. RFK Jr. is facing a potential setback in his quest to make America healthy again. A draft of an upcoming government report suggesting ways to improve the health of American children does not recommend severe restrictions on ultra-processed foods, something the HHS secretary has pushed for. This is according to a copy of the document obtained by ABC News. Now, the health department is declining to verify the draft's authenticity, with the White House saying it's, quote, speculative literature. Joining me now is former FDA Commissioner Dr. David Kessler, who has formally petitioned RFK Jr. to remove key ingredients in ultra-processed foods. Now, you tackled big tobacco, trying to regulate nicotine in cigarettes. What exactly are you calling for with these ultra-processed foods, and why?
So you ever look at the ingredient label, Ike, on food? You see terms like glucose syrup or maltose, maltodextran, invert sugar, dextrose, corn syrup, corn solids. Do you really know what that is? I mean, those substances got on the market because of a loophole, really, in the nation's food safety laws. They got on the market because there's this thing called GRAS, generally recognized as safe. Now, it's been 4 decades since FDA reviewed the scientific basis, the GRAS status of those substances are all processed refined carbohydrates. And it's been during those 4 decades that America's obesity crisis has emerged. So the petition calls on the administration to remove processed refined carbohydrates from the food supply on the basis that they should no longer be considered generally recognized as safe. If the food industry has data that such use can be used safely as it's consumed, then let it show it. But the FDA, just as nicotine caused millions to be addicted and sick in tobacco, so do these processed refined carbohydrates cause much of America's chronic disease.
Now, you say we have to rethink how we make foods in this country. So how do we actually go about doing that?
Not a small undertaking. But the fact is, we now give the administration, we give the secretary has an enormous opportunity to reshape the health of the American people. And we give him, in essence, a regulatory hook. We found the regulatory hook for tobacco. Is nicotine a drug? And I think there's a similar regulatory hook that these substances were found to be GRAS decades ago, but the science shows that they are no longer GRAS. So there's enormous opportunity that the secretary has simply to say, hey, industry, these are no longer GRAS. We really have to think about how we make food safe again.
Now, I do want to talk about something. With this draft being released, how hopeful do you think change will actually happen?
Look, how long did it take us with tobacco? It's a chipping away. These are chapters. But once you get the ball rolling, once the industry understands that the assurance that their products can remain on the market, maybe it's not this administration, maybe it's the next. But there's no consensus that these products today are these refined carbohydrates. There's no expert consensus that they are safe under the present conditions of use. So there has to be a fix, and that gives everybody an opportunity to think how we, in fact, can enhance the safety of our food supply.
All right, Dr. David Kessler, thank you for that information.
Thank you, Ike.